I want you to do something for a moment. Notice your jaw right now as you're watching this. Is it clenched, even slightly? Notice your shoulders. Where are they sitting relative to where they could sit? Notice your gut. Is there anything there? A low level tension, a bracing quality that you've been carrying for so long you've stopped registering it as unusual. I ask because the body does not lie. It does not perform. It does not manage its symptoms for the benefit of whoever is in the room. It files reports continuously, accurately, with extraordinary persistence. The question is whether you are fluent enough in its language to read them. For me, it was in my chest, a particular quality of tightness that I had treated for normal as so long it had become invisible. Your body's own dispatch is sending you messages if you choose to listen. I'm Dr. Jen Draper, and this is episode 3. Today we go clinical into what stored emotion actually looks and feels like in the body, why it's there, and why high performers are statistically the last to read it. Your autonomic nervous system does not have an opinion about your ambitions. It does not know if you have a board presentation next Thursday. It does not know that the relationship friction you've been managing is not technically a life-threatening situation. It knows one thing: threat or safety. When it perceives threat, real, imagined, remembered, or anticipated, it mobilizes. The sympathetic branch accelerates, cortisol surges. Your prefrontal cortex, the seat of nuanced thinking, genuine creativity, long range planning, goes partially offline. You call that state being productive. Your body calls it an emergency. Here is what the best trauma researchers have articulated for decades, and what I watched play out in clinical practice for nearly 30 years. The body stores what the mind cannot process. When an experience exceeds your capacity to integrate it, when the emotion was too large, the environment too unsafe, the relationship too fragile for truth, your nervous system does something extraordinarily intelligent. It compartmentalizes. The amygdala flags the event as dangerous. The hippocampus fails to fully file it as in the past, and the body carries it forward. I call these significant subconscious emotional events, or SSEEs. Not necessarily dramatic, most of them are not. Most are cumulative. The thousand small moments where safety was conditional, where love had a performance requirement attached, where your authentic response was overridden because the environment couldn't hold it. Now, I recall a patient, a woman who was in her early 40s, in a very demanding professional role, who had been referred after an extensive workup for persistent headaches. In fact, I had referred her. I was her GP. Her neurology was clear. All her imaging was clear. All her bloods were clear. Everything was clear. And I asked her, where do you feel it? Not just the headaches, but where in your body do you carry this? She looked at me as though the question was unusual, and then she said, in my jaw. I've had tension in my jaw since I was probably 22. 22! She was 43. 21 years of a stored emotional event living in the muscles of her jaw. Not because she was broken, because her nervous system was extraordinarily efficient at holding what the environment at the time couldn't process. The headaches were not the problem. The headaches were the body's most recent escalation in a 21-year conversation. Now let me give you the list, not as a diagnosis, as recognition. The jaw tension that you've had for years, the chest tightening in certain meetings, specifically certain meetings with certain relational dynamics, that inexplicable dread every Sunday evening that no amount of routine has resolved. The rageful response to something objectively minor, disproportionate in a way that tells you it's not about what it appears to be about. The numbness after success, the hollow feeling where there should be satisfaction and joy, the exhaustion that just doesn't resolve with rest. These are not character flaws. These are some of the stored emotional events that never completed their cycle. So, emotion is electrochemical. It is a biological process with a beginning, a middle, and an end. When the end is prevented, when the environment remains too unsafe or it was too unsafe for the emotion to complete initially, the cycle remains open. An open emotional cycle does not close through time, it closes through completion. So here is the critical insight for this particular audience. You, the people who are listening to me now. The more capable you are, the more efficiently you learned to suppress. You didn't fall apart, you adapted and you were praised for it, which of course made the adaptation stronger, which then made the suppression more sophisticated. The individual who could hold it together in the operating theatre or in the boardroom, in the difficult family system, that individual has a nervous system specifically trained to override its own signals in service of performance. The override is the competence, and the competence is the thing that is slowly, quietly compounding. Your body is not betraying you, it is briefing you. The question is whether you are willing to read the briefing. Now, before we close today, I want to give you one practical thing. Write down one physical symptom that you've been treating as an inconvenience. Just one. Maybe it's the jaw, or the Sunday dread, or the flatness after wins. Just write it down and date it and ask yourself, how long has this been present? Or ask your significant other, because hopefully you've told them about it. Because that duration is not irrelevant. That duration is the length of the conversation your body has been attempting to have with you. Mine also was an ache in my jaw, corresponding to the alarm I developed after an incident when I was 12 years old, when my jaw was injured just before a significant emotional event, which meant a change in living circumstances. I recall it now as a lesson, but only after a long time processing that hurt wounding that my inner child carried. Now, in episode 4, we are going to be discussing why comprehending your patterns changes absolutely nothing, but what actually does. I'm Dr. Jen Draper. Stay with me.